And good morning, and welcome to Quality Perks. As you know, I'm Karen Dupree. I've also got Neil Eggers here as my
Morning.
co-host. We have invited some great folks from Christine Clarson and
Hi,
also
everyone.
Steve Hyde, and we
Good
are
morning.
specializing in our discussion today on healthcare and the call center industry. But first, as we start off every discussion, what are you drinking?
Who goes first?
All
You
right.
can go first.
I'll go first. I'm drinking Indian River Coffee Company. It's a local coffee company here in Melbourne, Florida, and it's hot out. So I've switched to iced coffee. So it's in this mug today.
Excellent.
Well, I'll go next, and I am not a coffee drinker, so I'm going to be letting the side down, but I'm promoting the side of the tea drinker. So I've got my mum mug today as well because it's Mother's Day weekend coming
Happy
up.
Mother's Day.
Thank you all. So I have my mum mug that my son gave me. And I drink English breakfast tea. I like my Twinings English breakfast tea. So that's what I'll be sipping along today.
I love that. I love that
And
brand
I do have it with milk and sugar as well, the British way.
Do you have your biscuits with it?
In the afternoon, I might have a little biscuit with it as well. Yes, or a scone. Yes, just to keep it all traditional.
So the afternoon. So a running theme here is how many cups of tea do you have throughout the course of a day?
Well, it could be 3 or 4. You know, like
right.
2 in the morning and maybe 1 or 2 in the afternoon. Yep. Gotta have your tea.
You're on my side of the fence. We've had some guests on who it's only 1 cup, but I'm like throughout the day.
Throughout the day, you gotta have it. You know, the colder days you want more tea than others. But I don't like the iced tea. I'm not into the iced tea. It's got to be piping hot tea.
Very nice. And Steve, what do you have?
Well, I'm done. So I've just got the empty cup here. What is it? It's one of those ones that doesn't let the heat off. So I can nurse a single cup of coffee for several hours because I like it hot. But I typically, I'm boring. I have Kirkland Signatures K-Cups. Pacific Bold in bulk. The easiest to do. I'm pretty unadventurous there. And I typically like creamer with a side of coffee. So cinnamon, vanilla, coconut, any of the good flavors, I like to brew coffee.
That's not coffee. Karen and I have had this discussion on it. When you put all that in there, it's not coffee. That's dessert. That's what that you have dessert.
Eat dessert all day. That's
exactly.
Probably why.
Yeah.
So yeah, I'm a 1 cup per day. Occasionally, I may have a second cup, but it's got to be decaf. I have learned as I've gotten older, I can't do too much caffeine, and I just get a little too jittery.
Right.
So
like my 9-year-old running around the house.
Yes, I've already switched over to my water. So
all right.
I'm good there.
Good for you. And I'm actually drinking San Francisco Bay hazelnut cream in my little what is this? A compostable only K-cups. So, you know, I'm not adding to the global warming because of my coffee addiction. And
what else is in there? Let's hear all the things that you put. What creamer are we going with today?
Well, I always go with my vanilla almond milk creamer. So
good.
And so I'm a mom too, but I'm a sports
Happy
mom.
Mother's Day.
Happy Mother's Day.
So I'm either eating, sleeping, or driving to practice, or used to. Now that my daughter can drive, I don't have to do that anymore.
Oh, that's fun.
Yeah.
Very nice.
Excellent. Well,
so we've got two Pacific Northwest coffee. Steve, yours is from Pacific Northwest, and Karen, you're from the Pacific Northwest. We're strong coffee region, I guess.
Yes. Mm-hmm. Well, it's funny. It's like I can't drink weak coffee, even though I douse it in creamer. It's still got to be strong, bold, flavored coffee.
Yeah. We had a vet Don was our last guest, and we'll have to poll her. She's our resident coffee expert to see how she feels about all this. But we can transition into our regular conversation now that we're done talking about your coffee desserts. The two of you. So So to kick us off, I guess, as we've been preparing for the show, and both of you have extensive experience in the healthcare industry, was looking if you could share with us how healthcare call centers are different from traditional call centers.
Yeah, so great question there, Neil. So the healthcare call center, it is typically more focused on engagement with the patient, and their experience, rather than traditional call center metrics, and handling as many calls as possible in the shortest amount of time. And I'm sure everyone knows that healthcare can be very complex. You have doctors' offices and clinics and hospitals, and there's also the insurance companies and the PBMs to consider that all manage and impact a patient's care. So for example, there are many different avenues to just fill a prescription. We have the brick and mortar pharmacies, we have specialty pharmacies, there's mail order pharmacies, and now we've got online pharmacies. I mean, who knew there were so many pharmacies out there? And then you've got your insurance, and they may allow you to, fill a prescription at, any of these pharmacies, or there might be selective, and only some of them are allowed for the particular medication that you want to get filled. So that could be dependent on the therapy that's being prescribed by your physician as well. So it's just one of the many complexities that, healthcare call centers must really be able to assist with. And this makes it very different from a traditional, type of call center as well. So Steve, what's your thoughts on that?
I definitely agree. The focus of the call center being more the patient and their experience. But who do you think healthcare call centers face many of the same challenges, right, as any other industry? You've got wait times, call resolution, turnover, things like that. But they face more scrutiny, right? Government regulation than other industries. And then you also have a different perspective than the traditional contact center, where your caller is not trying to return a product, right? They're calling regarding their healthcare, which makes that associate on the phone really a member of their care team, right? Kind of the holistic approach there. And I also think healthcare centers deal with probably more change year over year due to the regulations and requirements, as well as kind of plans and updates and things to coverages, all of which makes it really critical for those centers to have an efficient, kind of flexible quality program in place, which is really where we come into play, BPA.
Mm-hmm.
So let's expand on that a little bit. Can you talk about how a quality program like ours would help a healthcare call center?
Yeah. One of the great things about what we do here at BPA is we're extremely fluid, right, in our ability to expand or change focus. Great example is how we can adjust our audits during open enrollment periods, where there can be an increase in call volumes along with those questions that come about new plans and such. We can add temporary enrollment specific metrics to our evaluations, and then we document findings in near real time to provide that immediate feedback that these call centers need. And then with situations like that, where you've got something that's seasonal or temporary, waiting even a week, right, to provide that feedback can greatly impact an organization on the negative side, right? So getting results quickly and being flexible is essential to that. Christine, what about you? What about your experience with how our quality program can kind of help the healthcare call center?
Yeah, I mean, I really think, and a really important aspect, and not one to get forgotten in all of this, is, the patient staying compliant to therapy and really improving, the health outcomes for the patient. And this is where the healthcare call center can play, a really critical role in providing, those emotional connections as well, and that trust and empathy, and really make a personalized, patient experience. So a quality assurance program, like we have at BPA, can see all of these areas, really help tell that story about what that patient journey is like, where those opportunities are. We can also take a look and offer insights and intelligence, on that patient experience, there's also this entire, life cycle that the patient goes through. Anytime they engage with the healthcare providers, that call center is a critical component, of that journey of the patient.
So we hear that term a lot, the life cycle, and it's a very distinctive term. How does it resonate, or how does it fit into the environment when we're talking about healthcare specifically?
Yeah. So healthcare, the call centers, they support almost every stage of care, that the patient goes through. And you can really think about this probably in two phases. I mean, the first phase is that pre-service or the pre-care items, like enrollment, that benefit coverage questions, quoting copays and deductibles. What are those out-of-pockets? Obtaining authorizations, for services, those prior authorizations that need to go in. And then the second phase is your post-care activities, that can include, the billing and reimbursement. How do we pay for all of this? Our prescriptions and, long-term care support and disease management. And we've also got the follow-up that is needed with doctors and nurses, and, don't forget the pharmacist in that equation as well. So there's so many facets, to this life cycle, which is why, it's so critical and so important for these call centers to really provide that high quality, service to their members.
So that was a lot of steps. So a lot of different aspects that go into, the first and the second phases, the items that you were mentioning, a lot of variables that exist in an interaction. So I guess what would be the biggest challenge or risk to a contact center out of those items that you mentioned, or the different phases of the calls, and how would a quality program help mitigate that? In your experience, how have you seen a quality program mitigate those different variables?
Well, I think there's a lot of challenges, not just, a singular challenge that stands out. The first thing that comes to mind really is on documentation, right? Anytime a member or a provider calls about anything pertaining to their care, the associate has to document it. Everything they quote, everything estimated, stated, you name it, it's got to be documented. This is definitely the biggest area we provide insight on. One of the things we're able to do is take evaluation data from multiple call types, and we can compare them and see where a certain type of documentation area maybe is more prevalent. And then we can provide suggestions for how to reduce them. I'd say another challenge is on the HIPAA side, compliance. All that information being shared over the phone is reliant on proper caller authentication. These call centers hear from spouses, children, power of attorney, you name it. It's not always the patient that's making the call. So the importance of verifying the identity, right, of the caller, or confirming who information can be released to, cannot be, understated at all. And then maybe one final thing, because Christine got me thinking about this with the prescription, the pharmacy side. One of the things we've seen over, the past decade, maybe longer, is a shift to more of these mail order programs, or getting patients access to cheaper alternatives than the name brands, and then numerous other programs, right, designed to reduce costs to both the patient and the insurer, which means getting access or increasing use of those offerings is a big deal. And these healthcare call centers are the main conduit to do so. Our involvement helps spotlight trends or areas where associates may need additional coaching to improve their success in getting patients to subscribe to those programs. So lots going on there, and our ability to kind of look at things from a high level, we can really help connect dots for some of these call centers.
Christine, any, from your perspective, challenges you've observed in the healthcare setting that you'd want to share?
Yeah, absolutely. So, from my experience in the healthcare setting, the biggest challenge is one that I mentioned a little earlier as well, is ensuring the patient is compliant, with their prescribed therapy, because that's at the end of the day what it's really all about. And the call centers must provide, any necessary help to improve, the patient's outcome. So to do this successfully, the call center rep, needs to be knowledgeable. So training is certainly key. I mean, not only for the points, Steve has just mentioned, but for the general industry knowledge, needed on insurance plans and knowledge about pharmacy and, technical or medical terminology, but also on that human compassion, to services, for each and every call successfully as well. We can't forget about that. And this can be a very daunting task, for all call centers, in the healthcare sector to really meet.
Yeah, and it's difficult to put all of those together, right? The product knowledge, the listening to the customer, and then the empathy at the same time, or that forming that human relationship. So, and that's been a theme, I think, through all of our episodes, is the Quality Perks episodes, is that those three things: the knowledge, the compassion, and the connecting with the customer.
Right.
So it's certainly an important part. So great conversation. To kind of wrap us up here, what does the future look like? What are things that the two of you would like to see changed or improved inside the healthcare contact center environment specifically?
Mm-hmm. So Neil, as healthcare and as all call centers, continue to evolve, my hope is we'll begin to experience a more seamless journey, which includes, easier appointment scheduling, more robust benefits investigation, appointment reminders, education and, prescription refills and help with disease management. The call center needs to be that one, centralized point of contact, but assisted by those knowledgeable, trustworthy, and caring people. And I think, BPAs with their quality assurance program is, perfectly situated, to help healthcare, call centers really navigate this.
Yeah, and I totally agree with Christine on that single point of contact, that seamless, less complex, right, environment for patients. I think that's where I'd like to see the future go. That continuation to try and simplify things for members, reducing the barriers, roadblocks, which aren't necessary, identifying what is regulation or what's required by regulation versus maybe something the provider or insurer thinks is necessary, but may not be. Anything which can be eliminated, simplified, makes that call center job easier, right? And would allow those associates to focus more energy on the patient, kind of what we've been talking about, that patient experience. A lot of work to do, right? We've covered just the tip of the iceberg today, but I think we're going to be involved in this journey for many years to come as we continue to support it.
We're all about simplifying the customer experience and making it a little bit easier and not that painful contact center moment.
Right.
So that would be beneficial. Christine, Steve, thank you so much for your expertise and insight.
You're welcome.
Thank you for coming on the show. Karen, as always, it's great to work with you.
Absolutely.
And we will see you on the next episode of Quality Perks. Have a great day, everyone.
Have a great weekend.
Happy Mother's Day to everyone out there.
Thanks, everyone. Thanks for joining. Bye-bye.
Bye.